drop down or spring up menu will say chat, and you can choose chat and put your question in there. It would be best if you sent the question just to me, so it won't be distracting to everyone and to the speakers while they're talking. And then if you want to see all the other participants, if you haven't done Zoom before, there's the little rectangular boxes that are connected by straight lines that you can push on to see the other participants. Today, first we are going to start with Vanessa Nordyke. She's a Salem City Councilor and Assistant Attorney General. Is that correct, Vanessa? Yes. And she needs to go to another meeting fairly soon, so we're going to start with her. And so go ahead, Vanessa.
Well, good evening, everyone. It is my honor to be here, and I'm happy to answer any questions. Cindy, did you have an opening statement or a question that you would like me to begin with this evening? I'm sorry, you're muted. I'm sorry, I cannot hear you. You're muted.
Well, some of the, you had just been doing so many videos and with such enthusiasm about the things that have been going on in Salem and to help people, you know, from the food drop-off places and the new shelter ideas. And also the Cahoots program. I kind of had a question about the safety of the, how do the mental health workers do it and stay safe? And I mean, not that homeless people are all dangerous or anything, but that's.
Well, sure. Well, why don't I, with your permission, I will give you just a quick tour of some of my activities since joining City Council, and then I would be happy to share my thoughts on the Cahoots or Mobile Response Unit model. Good evening, everyone. I joined City Council in late 2019. I was appointed by Council to complete the term of my predecessor for Ward 7, Sally Cook. And I was elected to a 4-year term in 2020, and I'm now starting that 4-year term right now as of January 2021. And I knew when I joined council that homelessness was at a crisis level in our city, and that above all else, it simply must be addressed. We know this not only from the visibility of homelessness, which has greatly increased in recent years, but also based on a survey of the residents of Salem, who have stated multiple years in a row now that homelessness is the #1 issue that they would like to see addressed. And I want to be clear that in order to end homelessness, no single entity can do it alone. The city can't do it alone. Our community partners can't do it alone. The county can't do it alone, and the state cannot do it alone. To truly end homelessness, you need the private and public sectors working together, communicating, sharing resources, and using money as efficiently as possible. To that end, Housing First is the most data-driven and evidence-based model for not managing, but reducing homelessness. I like to call it the LED light bulb of addressing homelessness, because there's an upfront cost and long-term savings. The upfront cost is that with Housing First, it is exactly what it sounds like. First, you house people. If you've ever seen the Maslow hierarchy of needs, you will know that housing is a top priority for every single human being on the planet, and that it is very difficult to arrange for the basic necessities of life until and unless you have a stable and safe place to call home each and every day. But Housing First does not mean housing alone. It also means that once you house persons, even if it's through a temporary shelter like the one we just installed at the Oregon State Fairgrounds Pavilion, you need to follow that up with case management services that enable persons experiencing homelessness to become invested in stabilization. You need hand-ups, not handouts. And case management services accomplish that, while housing means that you can actually follow up on all the things you need to do. Things like getting your Social Security, things like getting your medication, things like going to a job. All of those things flow and happen much more easily once you have a stable place to call home every night. Now, within my first year of council, Housing First was introduced to me by trusted community partners like the United Way at the Mid-Willamette Valley, like the Community Action Agency, like the Salem Housing Authority, like Family Promise, Center for Hope and Safety, and all the other great community partners. I've toured and met with many of the executive directors and their teams that have helped educate me on the reality of homelessness in our city. And that is something that we all should be aware of too. Homelessness can happen to anyone. One of the fastest growing groups of homeless persons in the state of Oregon and indeed the country are senior citizens. We have plenty of senior citizens on fixed incomes where they need to carefully ration out their savings on a monthly, if not daily basis. And unfortunately, sometimes those fixed incomes are not enough to cover costs, especially when life intervenes, when you have the unanticipated medical bill, the higher than usual car repair, or other expenses that come from living in a home where you've lived there for the last 30 to 40 years. Homes need maintenance, cars need maintenance, people need maintenance. All of these are costs that can sometimes drive our seniors out of their homes. I can tell you from having met with homeless persons in Wallace Marine Park that this is a reality, that one of the gentlemen that I met who lives in Wallace Marine Park is a senior citizen, and he lost everything because he got cancer and his medical bills were too much. This is how homelessness can happen to anyone. The other end of the spectrum of homelessness includes children. We have about 1,000 Salem Keizer students who are homeless, who are couch surfing, living in motels, experiencing housing insecurity. I toured an elementary school where they have a washer and dryer on premises because too many of their students don't have access to laundry services. And so they use the laundry service on premises to ensure that they have a clean jacket and other clothing just to get through their day. We also know that about 40% of our homeless locally are women. And thanks to our partners like Safe Sleep at United Way, who you may be hearing more from later tonight, we know that we have several women-only shelters in the area, including Safe Sleep, shelter provided for Center for Hope and Safety, and Samanka Place in Keizer. I've met with all these individuals, with their leadership, and I've toured their facilities. And that's another asset, that's another facet, of homelessness that people don't often realize, that we have a lot of people fleeing sex trafficking, domestic violence, and so on. One thing I can tell you that homeless persons seem to all have in common is trauma, which is why veterans tend to be one of our larger groups of homeless individuals as well. And we have Tanner's Project and Vet Care and others in town who provide housing and services to our vets. The only other thing I will say to kind of give you my impression and my assessment of what I've read and seen so far, I want to make sure that I give a shout out to the people we already serve. What many people don't realize is that there are about 8,000 people off the streets right now through various programs administered by the Salem Housing Authority. Right now, we have 7,950 household members in affordable housing, public housing, and Section 8 housing. This includes 1,030 persons with disabilities. This includes 3,172 children. All of this data, if you would like to follow up on, is available in a staff report that was presented to Salem City Council in January of this year from the Salem Housing Authority. The average household income for these nearly 8,000 individuals is $27,814 or less. So I want everyone to take a moment and recognize the fact that we already keep thousands of individuals off the streets through Salem Housing Authority alone. That does not include the other shelters, our network of warming shelters that are up through the efforts, valiant efforts of our community partners. So that is what we are already doing. But I understand that the League of Women Voters wants to know what comes next. From the City of Salem's perspective, I can tell you that affordable housing is a priority that I have been trumpeting from day one. It is clear to me from the data that you can draw a direct line between the affordability of housing and the level of homelessness in your community. Unfortunately, the entire state of Oregon has not kept pace with our housing market. Oregon has been a destination for retirees, families, and out-of-state workers. We're getting too popular for our own good, and housing prices have been driven up across the state, not just in Salem. And unfortunately, we have a lot of individuals in Salem right now who are cost burdened, meaning that at least 30% of their monthly income goes towards rent or otherwise keeping a roof over their head. So affordable housing is something I will urge our city to prioritize through zoning, through multifamily dwelling regulatory requirements, and so on. I have been working with folks like United Way to support creating tiny homes. The reality is not everyone needs a 1,500 square foot house or a 3,000 square foot house. Plenty of people, especially people with mobility challenges, especially our seniors, need a small place, a dignified place to call home that sits right in the middle of our community. And so I look forward to working with folks like United Way to support tiny homes to add to the diversity of our housing availability throughout the city. There are other projects in the works too, like Sequoia Crossings. That is a project that will be located on Broadway Street that will have 77 units. That will include everything from studios to 2 bedrooms. That will provide affordable housing for our most vulnerable and chronically homeless neighbors. We have so much more work to do, and I will continue to lobby the legislature to support things like bringing a navigation center, which again is all about bringing people indoors and connecting them to services. And I will continue to recruit volunteers and donations for all of our community partners and our shelters to do the good work of bringing people indoors, which is priority number 1. We want everyone to have a safe and stable and dignified way to call Salem home. If you'd like, I can now move on and talk a little bit about mobile response units. All right, so when I was brand new to council and I was reaching out to all the leaders of various community partners in the community, and I still have a few more to visit, I quickly heard about this mobile response unit program called Cahoots, which is based out of Eugene. Cahoots has been around in Eugene for about 30 years. It is a mobile response unit, which consists of 2 individuals with 2 different but very important skill sets. There's a mental health professional and a medical professional. It could mean a QMHP or a qualified mental health professional or social worker. It could be an EMT or a paramedic on the other side. And this dynamic tag team has been working in Eugene and saving Eugene a great deal of money. If you go to the Cahoots website, and I can drop the link if there's time before I have to leave for my next meeting, you will see that on Cahoots website itself, they estimate saving the city of Eugene on average $8 million per year, 8 million per year. And the reason that they get to those numbers, if they look at the savings of having a mobile response unit respond to calls that would otherwise automatically go to police and fire. Our police officers are very well trained, very skilled, and you need, frankly, the right tool for the right job. But there are plenty of opportunities in the field where you do not need a law enforcement officer's level of experience and expertise to respond to, for example, concerns about a transient loitering outside a downtown business. I can tell you that from the moment I brought up mobile response units, the response I received from our community was unlike anything I have brought up in my year on council. People came out of the woodwork, business owners, the Salem Area Lodging Association, mental health advocates, homeless advocates, and plenty of people in between, because we see the need for this. In Cahoots, they will tell you that they are piped into the 911 system, and they take calls that would otherwise go to police and fire. And in the year 2019, if I remember correctly, they responded to some 24,000 calls in a single year. And of those 24,000 calls, they requested police backup about 150 times. You may have seen in the Statesman Journal that the city of Denver recently instituted its own mobile response unit. And they have reached hundreds of people through their mobile response unit and did not need to make arrests, did not need to request police backup. The evidence from Cahoots and Denver and other cities who have instituted a mobile response unit demonstrates that there is a separate and independent need for these units apart from police and fire. Indeed, these units free up police and fire for higher acuity calls, for calls involving greater levels of dangerousness. So I have been working with the city and United Way and other community partners to bring this successful and evidence-based practice to the city of Salem. I encourage everyone to follow my Facebook page, Salem City Councilor Vanessa Nordyke, where I post updates on my efforts on the Cahoots or mobile response program and other homelessness related matters and other city matters. You should also know, if this idea intrigues you, we're not alone. In the legislature right now, you can start tracking House Bill 2417. That's House Bill 2417. Again, I've already posted updates on House Bill 2417 on my Facebook page. You're welcome to follow me there. But I can tell you that there are a half dozen representatives in the legislature, if not more right now, who are co-sponsoring a bill which would provide matching grant funding from the state of Oregon to cities and counties who want to form their own mobile response unit. Clearly, this idea is gaining traction. It was even, the Cahoots model was even featured on The Daily Show with Trevor Noah. We also know that Senator Ron Wyden, my senator, and I say that with a smile because I interned for Senator Ron Wyden back when I was in college at Georgetown, and I've been a big fan of his ever since. But Senator Ron Wyden has introduced a bill in the federal legislature that would hopefully bring that kind of funding at the federal level. Who knows? Who knows what will happen to either one of these bills? But I can tell you that if you believe in this program as much as I do, and I fervently believe in it, then there are ways to support it. I'll stop there.
Okay, thank you, Vanessa. We don't have a lot of time for any questions for you. It looks like someone asked if those tiny homes have restrooms, is one question.
Yes, they do. And when you get to speaking to Liz Schrader, she can tell you more about that. But I've toured a couple different tiny homes, and yes, they absolutely have restrooms on premises. Some tiny homes are 2 stories, and the one that was parked on United Way's lot for a while is all single story, all inclusive. It's perfect for a senior citizen. You've got your washer, your dryer, your kitchen, your bathroom, all contained within one efficient ground level space.
And I had the question, what is a navigation center? Other than, isn't Arches a navigation center, or is there something more than that?
Great question. So Arches does operate a day center right now. I have volunteered at that day center and helped serve lunch there during the annual point in time count for counting homelessness. But that does not make it a navigation center itself. A navigation center is a complete shelter, not a day center like the one that Arches operates on Commercial Street. It is an overnight low barrier shelter. Low barrier meaning that it is co-ed, you can bring in a pet, and they will permit people with mild, and I do stress this, mild levels of intoxication. So it would provide services, it would assess needs and provide shelter. But the idea is that it provides the short-term stability of a shelter, but also the kinds of navigation that you need to get people reconnected. The things that you and I take for granted, like having a mailing address, having a stable computer connection, things like that. Those are the kinds of things that some of our day centers and navigation centers and so on can provide. If you're interested, the day center for homeless youth in town, the Home Youth and Resources Center, that's just one of the places where they provide the kinds of services that most kids, including myself growing up, take for granted.
Okay, well, thank you, Vanessa, very much for speaking with us, and we'll let you go to your next meeting.
Thank you so much. I will drop some links in the chat before I leave, and
okay.
Please, by all means, reach out to me if you have any questions later on. Bye-bye.
Okay, thank you. Bye. Next, we will move on to Mayor Cathy Clark, who is the chair of the Mid-Willamette Valley Housing Homeless Alliance. And she's a former league member as well. So she's going to talk about the Mid-Willamette Valley Homeless Alliance and what they're up to. So Cathy.
Thank you so much, Cindy. And it's so great to see you all. I recognize several of you from my very happy memories in League. Can you hear me okay? Sometimes my connection goes in and out. Okay. So if at some point you can't hear me, give me this and I'll know to pause for a moment. The Mid-Willamette Valley Homeless Alliance, I've got to step back about 5 years to a very pivotal conversation that I had with then County Commissioner Janet Carlson. I got a phone call from her saying, I heard you on the radio today at KYKN. I've been talking with then Mayor Anna Peterson, and we realized that the needs of the people who are in our community who are homeless are not being met. It's not that we aren't trying. It's not that we don't care. It's not that we don't have resources, but it's not working. Would you be willing to be part of a task force to dig in and find out what we can do? And I said, absolutely, yes. So a year later, we had completed the work of the Mid-Willamette Valley with the Mid-Willamette Homeless Initiative. We had representatives from Keizer, Salem, Marion County, and Polk County. Commissioner Jennifer Wheeler brought a team from Polk County. And we put together a strategic plan, not a 10-year plan to end homelessness that would sit on a shelf, but a plan of action. During that process, we heard from housing providers, health providers, builders, real estate and shelter management people, veteran services, people serving children and our students. We heard from the nonprofit community, the faith community. We listened to everyone who had a seat at the table and who was trying to take care of a particular sector in the whole landscape of housing and homelessness. From there, we were able to hire a staff person for a year until she was spirited away by an organization in Portland. But Allie Treichel was able to complete our money map and our asset map. At that point, we realized that we had a lot of will and we had a lot of resources. And this was the time to marshal those into moving in the same direction, building relationships so that we were making sure that our services were being delivered appropriately, that they were being delivered effectively, and they were making a significant and tangible difference in the lives that we desperately wanted to help serve. So through that, we began to work toward a number of things. One was the establishment of the Homeless Initiative moved forward with operationalizing sections of the strategic plan and began the work on reestablishing our continuum of care. Now understand that while HUD dollars are very nice and they're very important to a number of our local service providers, it's only a very small portion of the dollars that we spend regionally to help people who are experiencing homelessness, from the rapid rehousing to the chronically homeless, from children and families to our seniors. We realized that we had a lot of resources. And again, this was time to bring that together, to collaborate, cooperate, and establish interoperability so we could better serve people in our communities. Under the leadership of, at that point, it was former Commissioner Janet Carlson, who is a staff member for the Homeless Alliance, along with Jan Calvin, who is on the Zoom here with us tonight. And I may call on her to help me with some of the facts and figures, as she is an absolute amazing part of our team for the Homeless Alliance and for serving people in our community. We did reestablish our continuum of care for Marion and Polk counties. On December 5th of 2019, our application to reestablish the continuum was submitted to Housing and Urban Development in Washington, D.C. They were waiting for it because with their help and the very hard work that Janet put in, that application had been worked on all year long, all the steps, all the boxes, all of the things that needed to be done. Our approval came through on December 11th, 6 days later. That was impressive. But you know what was even more impressive? In the process of putting that collaboration together and establishing what then became the Homeless Alliance and the ORS 190 collaboration of government agencies and entities within that alliance, we had built relationships. We understood who we are serving. We understood who is at the table providing services. We understood what we had in terms of resources, and we knew where the gaps were, and we could start going after them. And boy, howdy, have we. I'm very pleased with the report from Councilor Nordyke, and you're going to hear later this evening from Kristen Rutherford, who is the staff member for the city of Salem, who has done tremendous work in this area. But one of the key realizations from the Alliance initiative and the Alliance was that we could not afford, and more importantly, the people who need services cannot afford silos. The prior continuum of care was made up of nonprofits. This continuum is nonprofits, the faith community, service providers, and governments all collaborating to bring what we do well together in providing comprehensive wraparound services that are appropriate for the needs of the people that we want to serve and who need services. We have a tremendous effort that has morphed into a part of the Alliance, and that was the challenge to end youth homelessness is now a key component, really addressing the specific and specialized needs of our students. Julie Kahn Johnson from the Salem Keizer School District is their McKinney-Vento coordinator. She does a fantastic job identifying students who are homeless, experiencing homelessness, either sheltered or unsheltered, a lot of them sofa surfing, and helping to collaborate and finding ways that our students can avoid being homeless and, most importantly, get to graduation, stable education, and then opportunities for jobs, employment, and housing. For our veterans, we heard from Steve Bobb from the Confederated Tribes of the Grand Ronde, and you heard about briefly about the Tanner project that is under construction in Salem that will provide housing specifically. No, the Tanner project is open. There's another project that is now under construction in Salem for veterans housing and services. Marion County stood up its Veteran Services Organization, and they have done a fantastic job connecting veterans with the services and benefits that they deserve. So we've been able to bring together collaborative efforts to meet the needs of people very, very specifically. I want to talk about one of the reasons we can do that and have a better idea of what we're doing. The point in time count is required, but it is not our best information and data system. We have the, Jan, correct me if I get this wrong, the HMIS, the homeless, and I always forget what the M is, information system. This is a metric that helps us assess the needs of people who are experiencing homelessness. They get into our database and they don't have to tell their story twice. We know who they are. So when when our service providers re-encounter this individual, they go, Joe, last time we talked, this is what you were, thank you, coordinated entry, homeless management information system. Thank you, Jan. They don't have to retell their story because that doesn't build their dignity or sense of value. You know, this is where you're at. How are you doing with that? What can I help you with today as people begin to progress? Jimmy Jones was also very key in helping us understand that while rapid rehousing for people who had lost housing and could quickly turn around and get back into housing was very rewarding, it was not the best use of our dollars. We were spending a lot of money there because the really difficult, hard to house, highly complex needs people take a lot of resources. That's a lot of work. But you know what? That's also not only the best bang for the buck in terms of human compassion and results, but it's also the best bang for the buck for our resources. When we bring wraparound services to a person who has been chronically homeless, and we found that most of our chronically homeless have been in our community between 15 and 20 years. They've been here a long time. They've figured it out, but when they get a little bit older, that gray hair thing, it's getting a lot tougher. And the chronic illness that goes with that hard life on the street begins to catch up with them. I'll come back to that. So because we recognize that some of our best work could be done for the chronically homeless, that's where some of the projects and collaboration began. So we're doing collaborative case conferencing. We have multiple agencies who work together to serve the chronically homeless and get them into permanent supportive housing. But do you know why that happens? It's because relationships have been established with those individuals for whom life has been very hard. And it's easier to be in the devil they know than take a risk at being disappointed again. Because of the relationships that have been built, a year ago when we got smacked upside the head with this thing called COVID, lives could be saved. We began to realize very quickly that we needed to provide information and services and sanitation and other life-saving services to people. How do you explain COVID to a person who's living on the streets and just surviving day to day, moment by moment? It doesn't register, it doesn't compute. But because our alliance was so strong, because all the different agencies knew each other, they were able to start establishing shelters, to be able to pivot with personal protective equipment, to be able to bring in hand washing, navigators to help people get into hotels and other housing facilities and get them off the streets where they would not be spreading COVID on top of everything else that they experienced, like tuberculosis and SARS and MERS, on top of everything else that they experienced. Because of that, lives were saved last year among our chronically homeless. And even more so, many of them said yes to moving into permanent supportive housing. Redwood Crossing, last report I got was almost full. I wouldn't be surprised if it was full. Redwood Crossing is one of the housing developments with permanent supportive services on site where some of our chronically homeless are now living. They're sheltered, they are getting the services they need, and they are starting to thrive. That is a success story, and we want to be able to tell so much more about what we are doing as a community because we work better together than we do separately. I also appreciate Councilor Nordyke talking about the mobile response units. I want to talk about something that Keizer began several years ago through our community response unit, our crew, and that we already have now as one of our alliance members lead the law enforcement assisted diversion, where we don't, we want to make sure that people who are emotionally disturbed, experiencing crises, have the appropriate people who respond. So we piloted a program where we partnered with Oregon Health Authority to have a mental health professional housed at the Keizer police station. If they got a call saying this is an emotionally disturbed person, and our police know a lot of the families of people who have family members who have all sorts of issues from substance abuse to mental illness to developmental disabilities. They know them, they have relationships. So they could send the appropriate staffing out there. And if this was going to be a law enforcement issue, they were there to respond appropriately. If this was going to be a social services issue, that person was there to respond appropriately and get them connected into services. So this, I would agree with Councilor Nordyke, this is a very successful model where you have the appropriate response to the appropriate need and get them to appropriate services. One of the problems we encountered, though, there was that they kept on taking the people that got trained up in our program. They're going, ooh, they have a great, OHA did. They've got a great skill set now. Let's see if we can take them someplace else and you can train another one for us. Okay, we're more than happy to. So we want to continue to grow that because it is very effective. LEAD is a very effective program as well, and Josh Lair represents that program on the Alliance Board of Directors. And I can't speak a lot to what that program entails, but I do know that law enforcement assisted diversion. You don't jail a person who is having a mental health crisis. You don't jail a person who is emotionally disturbed. You get them to the appropriate services as much as is humanly possible. If there's a safety issue, law enforcement's getting involved. You know, make no mistake about that. public safety for both the person involved and the people around them is very important. But having the appropriate response, training, and resources available helps have a much better outcome. And all of our police, Marion County Sheriffs, Keizer Police, and Salem Police are all trained in these appropriate responses. Thank you, Jan, just reminding me that the diversion includes the support of the District Attorney's Office, and they have been absolutely supportive of this. They love it. And Josh is employed by the Health Department for Marion County, if I have that correctly. So if we can find additional components that we can take from the Cahoots model and bring that into what we're doing here and bring that up to even a more effective level, I think that would be a great conversation to move forward with. And I know my police chief would be all in. How can we do more? How can we do it better? How can we make sure that people we respond to get what they really need for their safety, security, and their long-term success? So where are we going from here? Now that we've established the ORS 190, we are going to have a summit tomorrow between the collaborative committee and the Alliance board, looking at where we're at and where we're moving forward. The strategic plan we have is one that's always in motion. It's about how we come together and provide more of the services that we've identified need to happen here, more of the facilities. Councilor Nordyke mentioned some of them that are in this area. And then with the expansion of additional facilities like the pavilion at the fairgrounds, huge help there. The shelters that we have the warming shelters open now that because of the cold temperatures we're expecting this week, and then also the low barrier shelters. So with that, I would urge you to go to the Mid-Willamette Valley Homeless Alliance website, get our newsletter, read what's going on there. There's a lot of ways to get involved. And rather than start a new effort or a new nonprofit, I really encourage people, do what we did, come together and collaborate. The collaborative committee is one that is self-selecting. If you're a nonprofit, if you are a service provider, if you are a person who cares about serving people who are homeless, if you are a leader or a program leader in the faith community, we want you in the collaborative committee. And then different groups are working on different strategic parts of those programs to make sure that they help inform us on the board where we can continue to make progress in providing housing, providing services, and getting more and more people permanently and supportive housing and services. Jan, did I skip anything? Oh, MWVHomelessAlliance.org. So Jan, I'm going to ask if I skipped anything. Jan is amazing. Carla Munns is our additional staff person. So we have Janet Carlson, Jan Calvin, and Carla Munns, who are our 3 staff people of contract who are working with us to move forward the work of the Mid-Willamette Valley Homeless Alliance.
Okay, can Sharon, can you unmute Jan, or can Jan unmute herself?
Hi, I'm unmuted.
Okay.
Do you have a specific question?
So Jan, did I skip anything? And I know you can talk more about the collaborative committee than I can about what that looks like and how that has been able to move forward the work of the Homeless Alliance.
Oh, it's a wonderful open space. And in fact, I think everyone you listed certainly is welcome, but also just if you're interested, we've had just individuals sit in and come back. So we look at, yes, what provider issues are there, but we also look at what are the barriers. We do some barrier busting, problem solving things, and then we focus in on certain areas. So if it's equity, so in March, we're going to be having a session around equity and racial disparities within our homeless system. So each month there's a little bit different topic to focus on.
So I thank you, Jan. And again, I would really encourage people to log in to watch and then go back and read some of the work that we've been doing as well. All told, one of the things that has been key, foundational, and through everything that we do is remembering that we don't have a homeless problem. We have people who have deep, complex needs. And without a support, a network, without people to support and care for them, they're not going to be able to thrive in the way and experience the dignity and respect of our fellow human being that I believe that they deserve. It is the intent always that this is about a human being, a person. And we are going to do what we can to make sure that they know, that they feel the love, dignity, and respect that we believe that they are entitled to.
Thank you, Cathy. I'm going to allow in also Elizabeth Schrader. She had something she wanted to say, and I think since I know who she is, I'll allow her in. Elizabeth Schrader.
Thank you very much. I appreciate that.
Yeah.
I just wanted to add, Councilor Nordyke and Mayor Clark have highlighted several focus areas that United Way works to support. The role of United Way is to address some of the gaps between the need and the capacity of the area service providers. We do that obviously through fundraising and grant provisions, but also the latest that we've done. In 2019, we approached the City Council with the Cahoots project and asked them to consider bringing that to the city of Salem. At that point, we came as a partner with Arches and we asked for some funding. The main challenge is the fact that the sobering center that was established had not actually been funded and completed. There is a space for it, and the House bill that Councilor Nordyke, I'm promoting her, Councilor Nordyke mentioned, does have that. It specifies that they are matching funds and that the provision must have, the cities must have a sobering center. So that is something to consider as we look at bringing this service to our community. So United Way right now, we are actively working with our community members to bring a roundtable together again. We started in 2019. The City Council has made it a priority. So we are back at the table and we are looking at how we can implement this as quickly and easily as possible and dovetail into those services that are currently doing really great work for those community members, but need that assistance. So I did include in the chat a PDF of some of those, our booklet that we give out, and it does have projects in there so that you can become familiar with some of the work that we're doing. But all of those focus areas we're talking about, we currently, Linnell Wilcox is on this call. She is our manager for our Safe Sleep United Women's Shelter. It is a low barrier shelter. We just celebrated a 1-year anniversary on December 15th. And we also, in 2019, fundraised, and the Oregon legislature provided a great deal of our initial goal to establish the first shelter for homeless teenagers. And that is the day-to-day operation of that is run by Community Action. It's called Taylor's House.
Yeah.
And
Okay.
that's a fantastic home, and it won't be the last. I know there's another one that's planned for Polk County as well.
Exactly.
It is truly a pleasure to work with Elizabeth Schrader and with Stephanie Bobb at United Way. They are a great example of the partnerships that we have established. And they also are a tremendous example of an attitude of get to yes. When COVID hit, we were sitting around the table at our board meeting, and their executive director, Rhonda Wolf, was at the meeting, and a need was expressed for, we need hand washing stations for people who are experiencing homelessness. She goes, how much? $300, done. Right now. And that's the kind of get to yes that United Way and our other community partners have been willing to do. The fires hit, and the United Way is not a food distribution center. Yep, we are now. They were distributing food boxes. Whatever it takes to get to yes, collaborating with the Union Gospel Mission on collecting resources for families who had lost everything, organizing volunteers, whatever it takes to pivot to get to yes with our partnerships to take care of people in crisis. So I want to thank Liz, I want to thank Stephanie and the entire United Way team for being such a great leaders and example of how you get to yes in serving people. So I know you're going to talk about Safe Sleep, which is I'm a huge fan of.
Yes. Okay. Now I would like to introduce Stephanie Bobb, who is the resource manager for the United Way of the Mid-Willamette Valley. Stephanie?
Thank you so much. I've invited Liz to come along because although I'm extremely versed in a lot of our programs, she has a little bit better information about things that you wanted to hear about. But I would be remiss if I didn't mention that Steve Bobb Sr. is my father-in-law.
Oh.
So when you sound, I was like, yeah, that's good. So Liz is going to talk about our homeless efforts that we've got with tiny homes and what we're doing up the canyon and how we're helping the unsheltered. But one of the things that Cathy mentioned was Women United and the projects that we have going on. So we've got the wildfires, we did the COVID food boxes, but Women United has been supporting the Red Cart Project as well. The Red Cart Project puts tampons and pads into the hands of individuals who can afford them. It originally was supposed to be a community effort for high school and middle school students, but it quickly became a shelter and unsheltered project as well. And so we partner with Arches on those projects. And currently we actually have about 45,000 packages of tampons and pads that have gone out in our community since this project started a year ago. So although we have some other projects that are helping the unsheltered directly, we also had the food boxes. And when COVID hit, we were doing 88 food boxes to the local hotels where veterans were being housed who were immune compromised or couldn't get out to get their shopping done. So there is other programs that we have going on in the booklet that Liz shared earlier is going to help you with those things. But I'd like Liz to actually talk about our homeless initiatives and what we're doing for the unsheltered and the partnerships that we have.
So I think everyone is fairly familiar with the kind of the classic version of the United Way. We had a community chest. That's where it was actually started. Our United Way was established in the 30s here in Salem, and it worked predominantly as a fundraising model for nonprofit providers. And it used to be a membership organization as well. But in 2018, we took a hard look at what our role was in our community. And we support Marion, Polk, and Yamhill counties. So what were we doing to really move the needle on some of these issues that our providers are addressing? And we found ourselves coming up short. So having hard conversations with some of our providers and saying, tell us about that gap. What do you need? Community Action was one of the first to actually stand up and say, you know what? We need a shelter for teenagers. And that's really was the catalyst for us starting these community impact projects. So we really focused for the last 2.5 years on supporting those providers, the shelters, Community Action, Arches, throughout our communities. We support other shelters within Yamhill County. We support Polk County. Mayor Clark was mentioning the Veteran Center that opened in Polk County, and we provided them grant funding for that, as well as access to donated goods. So we're looking at this issue of the unsheltered as a regional wide issue, and how can we as United Way make the efforts of those providers more efficacious? How can we actually move that needle in a way that is supportive and sustainable? Because it won't do me a lot of good if I can bolster up one provider for 1 year and then another provider for another year. One of the biggest things that Councilor Nordyke referred to that I really want to highlight is that it truly does take overlapping of several community providers to make this project work. The program and the issues that we're facing are so complex and so varied in terms of solutions. Now, also add COVID, of course. Also add that several of the unsheltered folks that were living in the canyon increased the amount of unsheltered in our community overnight. And they, as unsheltered, they can't go back into the canyon. There are no resources there. So now our providers are strained even further. So for United Way, what we're looking at is how do we address that and work as smartly as we can. So we brought a shower trailer into our community. It's a 22-foot long trailer that has 3 individual locking showers, that has its complete thing, sink, toilet, whole 9 yards. It's completely sustainable. It only needs a generator, which it has, and then access to a water. So you can literally take it to a church parking lot or a park or a grocery store if that's where it is near a community that needs access to basic hygiene. So looking at those projects, and again, if you just take a look at the booklet that I posted there online, we started to see that one of the biggest areas, the biggest gaps that we have is sheltering for women. Women are at the highest risk on our streets for abuse and neglect. And Linnell will speak a little more succinctly about that than I can. Her heart is as big as the day is long about these ladies, and she has taken Safe Sleep with our partners. They have created a home for these ladies. They come in and they have a blanket. When we first opened, the ladies had little care packages. They truly care about each and every one of these ladies. So what Mayor Clark was referring to about being humans first is absolutely where we fall in terms of our position for how we help those ladies. So the next project, as far as looking at what we can do for the unsheltered, is a tiny home scenario. If you follow the Statesman Journal, you will have seen that a company, IHC, which is International Housing Concepts, they are located on Front Street, and they're fairly new to the community. Well, they're fairly new to the space that they're in, and they're new to our partnership. They donated a tiny home to us. It is not a tiny home. It is adorable, and it is fabulous inside. I mean, it's a retirement home for me. I mean, I'm telling you, it has a beautiful kitchen. It has plenty of space. It's not that kind of dorm room cramped, what you would normally think of as a tiny home. So this particular home is going to a family that has children, and it has a loft space where they can be. So what are the barriers for a tiny home? Right now, it's space. We have to have a space that is workable to have more than one, more than two. Our goal for United Way is to have 5 this year. Now, I would love to say that because it's February 10th, that by July, we're going to have that 5, and then we're going to demonstrate that that project is successful and sustainable. So we're going to right away turn around and do 5 more here and 5 more there and maybe 15 over there. But the truth is that, again, we need the land. And we do have a lot of challenge with the community of they have to be, this land, it can't be out in the country in West Salem. It has to be close to a bus line. It has to be close to resources. the people cannot rebuild their lives if we squirrel them away in some remote location so that they're out of the public view. They have to be a part of our community in a way that is impactful for them. And they have to have access to those resources. So that is our next big project. We are, as I mentioned before, we're actively working on the crew project, and we expect to launch that this, late spring, early summer is my goal.
One thing, if I may, Cindy,
Yes.
the land supply is very, very critical. Last year, and I know Kristen can talk to this in Salem, there were issues around zoning about being able to use particular zoned areas for shelters and so forth, and that's changed. But still, you have to have the appropriate location. You've got to have the services close by and convenient. You need the entire package. It's not just here's a key, good luck. People get to the point where they're ready for their own apartment and that stage, and then they can continue to make progress in whatever areas that they need to do that personal work. But right out of the gate, you cannot just put somebody into a space and walk away. There has to be relationship. There has to be support. There has to be trust, or they're gone. That's not going to work. So I really appreciate the thoughtfulness that's going into this. Now, Keizer, we've been asked several times, do you have any extra land? I don't know about
That was me.
you. I know. I would love to say yes, but the fact of the matter is we're built out.
I know.
Keizer is built out to the edge of the urban growth boundary because we share a UGB with Salem. Our buildable land is in South Salem and West Salem. That's where we're at. And we are struggling right now with our buildable lands inventory, housing needs analysis to figure out not only to build where we have the land, but where we can push out, if we can push out, and for what kinds of housing we can push out. It is a very complex issue that we're trying to tackle, and we have to do it in partnership. And I'm glad we get to do it in partnership with Salem. But I want to thank United Way for being very thoughtful about how we're putting together, just like all the other programs that through the Homeless Alliance members that they've been working on to make sure that they're setting everything up for the success, the maximum success of every client.
I did want to add, Cindy, by the way, you asked the question about how in the CAHOOTS model, the people that staff it remain safe. There is some comprehensive training about de-escalation. De-escalation, so if someone is having what is referred to as a mental break, and that's an alternate reality, if someone has either an addiction or some kind of mental illness and they come to work thinking they're Tinkerbell, then that scenario can escalate very quickly for the general public. And we have seen that, and I'm sure you've heard about that with the downtown business owners. So in this scenario, the MSW, so the mental health support worker who would be right alongside an EMT would interact with that person on site at that point. So the whole purpose of crew is not to scoop them up and squirrel them away at some place. The CAHOOTS and the crew model is providing services at that point of interaction. So between those two and the very comprehensive training, the de-escalation really is that model. Now, as Mayor Clark was referring about the trust issue, most of this population have had such a disparaging story about trying to work through the system and jump through various hoops that they have a severe lack of trust. And having that point of interaction is going to be a challenge for quite some time until those employees can build that trust with those populations. But as I said, we are going to work with a lot of our community partners. Be Bold Ministries actually is a great partner in this, and they are instrumental for those communities to go in there and introduce this program, just as if anyone was familiar with Alluvium, when COVID first started, City of Salem launched Alluvium to help with that COVID testing. And that model is very similar.
I just wondered if you could say what the CRU stands for, what
Sure.
that acronym.
Crisis Response United.
Oh, okay, thank you. Okay, Stephanie, do you have anything more to say or?
No, thank you so much. And I invited Liz to come along. A, she's my boss, but B, she is really involved in that piece of our organization. And I am more boots on the ground, baby kissing, handshaking, and fundraising at the workplace campaigns, and then being involved in our community. So everything that she said is amazing and wonderful, but she articulates it way better than I do. So if anyone has any questions for us, that's great, but I just appreciate the support.
Okay, great. So then we'll move on to Kristen Rutherford, who is the Urban Development Director for the City of Salem.
Hi, so thanks for
Kristen,
having
hi.
me tonight and letting me join this panel.
Thank you.
You're welcome. We've had a lot of really good conversation about the people side and people response side of the situation. I'm going to talk more about the product side of this, the housing side. But first I want to follow up real quickly. Mayor Clark had talked about the zoning issue and shelters. So I wanted to follow up on that real briefly. What you're referring to is the emergency ordinances that we've enacted due to COVID, which has allowed us to basically temporarily circumvent the zoning for emergency shelters. But as COVID resolves itself and the emergency orders go away, we will be back into, facing those same challenges with land use and siting shelters. And that does make it a really difficult challenge that I worked on with Arches a couple of years ago before Gretchen Bennett moved into sort of the homeless czar for the city of Salem and taking the lead in that role. So prior to her being in that role, I worked very closely with Jimmy Jones, not this last winter, but the winter before, in trying to find emergency shelter. And the land use piece and landowner piece, folks willing to lease buildings for shelter use, was a tremendous challenge, and it is still a tremendous challenge. People willing to lease land for shelter use, huge challenge, or purchasing a building or purchasing land for shelters or tiny homes ahead of going through the land use process is also a big risk, to put $1 million, $2 million into a property, not knowing if at the end of the day, you'll be able to get to the land use rights for that kind of use. Because shelters and these sorts of uses are allowed outright in very, very few areas, and buildings and land are just really hard to come by. So yeah, we have a little bit of breathing room right now because of the emergency ordinances, but that's not going to last forever. So we are having to be really creative in how we approach this. So so I wanted to talk a little bit more about the housing product side. And I've heard a number of folks on the panel talk about working smarter and more creatively, and that's what we're doing as well. 2 years ago in my department, we moved the housing authority under my department so that we could have better coordination between housing authority activities, urban renewal, which is a part of my department, the city's 8 urban renewal areas, and our federal programs, our CDBG and home programs, so that we can be a little bit smarter and better coordinated in how we are combining resources and a little bit more creative in how we're responding to needs out there. So, some of the properties that were mentioned earlier, Redwood Crossings is a good example of one of those. That's a Salem Housing Authority project. It is not fully leased up, but all the units are spoken for. So we have, I think, 4 folks still working through the move-in process. We had to slow it down a little bit because of COVID to make sure that we weren't getting too many people in there, you know, at the same time. But all those units are spoken for. We have 37 units there, and they have a homeless preference, and we have 6 respite units in partnership with a Salem hospital. So people that need a little bit of medical care, you know, post-medical care respite recovery space. We have units there. So that was a property that the Urban Renewal Agency acquired for renovation by the Housing Authority for this use. And this is a permanent supportive housing facility, which has the wraparound case management. There was some talk earlier about permanent supportive housing and that case management. And that is kind of a whole new ballgame, you know, for the Housing Authority and for the community. And it's intense, you know, it's, I think we've all probably underestimated the amount of staff support that is needed, the on-site support, the case management. And this community right now, I think, is really strapped for case management and for these additional supportive services. And it's something that's desperately needed. And so, you know, we're working on another project, another PSH, permanent supportive housing project at Sequoia Crossings. That will be 75 to 77 units. The Housing Authority is part of a cohort, state cohort, going through the pre-development process. So we're starting to work on our financing packaging for this. And the funding sources, there are, through the state's PSH program, I think there's going to be about $19 million available for construction, 8 jurisdictions competing for those funds. So it is really, really competitive. So we're applying for that. We're also going to be applying for 9% tax credits through the state to try to pull together funding. Unfortunately, that property is not within an urban renewal area, so we can't bring those resources to the table. But we can look at some of our other funds, like our home programs or CDBG funds through HUD as an entitlement community. In terms of those partnerships and leveraging resources, we talked earlier about Housing First. Salem has the Housing Rental Assistance Program, which is a Housing First model. We have partnered with about 30 landlords scattered throughout the city to provide rental housing to folks that are enrolled in this program. And we've had about 26 folks through this program so far. Other properties that we're working on and partnering on, we have Yaquina Hall, which is at the North Campus of the State Hospital. We've had a purchase and sell agreement with DAS for a few years now. The partition plat for that property was just completed. We're working on the wrapping up the financing now, because we've had to kind of continue to delay things because the partition took quite some time. We're looking to close on financing in October. And that project is going to be around 52 units, and it will have a preference for individuals with serious and pervasive mental health. We have other projects that aren't Housing Authority projects, but where as a city we've partnered. The Cornerstone Apartments out on Portland Road. We partnered with Mountain West in the development of that by providing urban renewal grants and home and CDBG funds to help bring, I think, was a couple of years ago now, I think 288 units or so out on Portland Road of affordable housing. In the downtown core, we provided an urban renewal grant for the Nishioka building, which is on State Street and Commercial. And that's going to be 148 micro units. So very small units with furniture that's built in so that they can keep the price point down. We've also created a brand new urban renewal area and kind of an innovative approach to using urban renewal to provide a property tax rebate for private sector developers to incorporate affordable units within their developments. So this pilot project is another Mountain West project out near Yaquina Hall. It's the Jory Apartments TIF district. And in that development, we will be getting 15% of the units within the total project will be affordable at an average median income of 60%. So that's going to be about 36 units. And so we're looking at that as a model where we can create single tax lot urban renewal areas around the community with private developers to get affordable units within market rate developments to add capacity. Because one of the challenges that we're all aware of is we cannot build as a housing authority or city, we can't build our way out of this fast enough. We have to partner and be creative with the private sector to get affordable units. Housing Authority has a property management program where we will also partner with private developers to provide tax relief, property tax relief in exchange for affordable units. So we're talking with probably 1 or 2 developers a month about that program. We also established a couple years ago a low-income rental housing property tax exemption program for nonprofit developers to allow property tax exemptions to encourage the maintenance of low-income rental housing in the community. And we also have another 10-year property tax abatement program that's geographically defined, includes the downtown and extends a bit to the east, called the Multi-Unit Housing Tax Incentive Program, MUTIP program. And that provides a 10-year property tax abatement for multifamily developments that are within that geographic boundary. So we have a lot of different programs that we've established and a lot of different partnerships and a lot of different ways to sort of bring different funding sources together to incentivize affordable housing development. We've also acquired the property where the UGM is currently located. And most of the rest of the block, not every single property, but we've got about 80% of that block that is under our control. And we will be issuing a request for proposals for redevelopment of that area, probably within the next 6 months. And looking there for, we'll be looking at proposals that will bring housing with affordable housing as a part of that redevelopment into the downtown core. So that's a really exciting opportunity because, you know, we need housing at all levels within our community and affordable housing mixed in with that, you know, and I don't know in terms of this audience, how familiar you are with kind of how we got to where we are in being the sort of backlog of housing needs, but coming out of the last recession, for a number of years, lenders weren't lending on multifamily housing. You couldn't finance an apartment project. You couldn't finance condos. You couldn't finance townhouses. I was working for the city of Wilsonville during that time period, and we had a lot of developers that had started and had designs for townhouses, row houses, condos that had to go back to the drawing board and redesign everything so that you had like a 2-foot gap between what were previously attached homes because they couldn't get financing. And so they could build one and then build another and build another, but they couldn't build 10 at a time, you know? And so that really took a situation, whereas Councilor Nordyke talked about Oregon being this, you know, really popular move to destination with a slowdown in construction of multifamily that just sort of blew up into the situation that we have now with this extreme housing shortage. So, so we're having to look at, space differently. We're looking a lot at adaptive reuse in our downtown. We've funded some analysis here recently to look at a number of properties within the downtown that are underutilized or vacant. Like we've looked at the mall. We've been in conversations with the ownership of Penny's and Nordstrom's, Liberty Plaza, even the Marion Parkade, to look at what can we do with these spaces? Can we build housing up on top? Can we go up of 1 story or 2 stories of housing? So we're trying to get really innovative in how we're looking at this, and then what sort of financial incentives would be needed for an adaptive reuse of some of these spaces. There's a lot of capacity to bring more housing into the downtown core by being creative like that. And, as we look at all of this, looking at ways to incentivize affordable units within those market rate developments. I think I'll stop there and see if we have any questions.
Kristen, I would like you to talk about, you talk a lot about affordable housing, and that's an area that Keizer's doing some work now with our billable lands inventory housing needs analysis. There's a definition and an income level difference between low income housing and affordable housing. Can you talk to that a little bit? Because most of what I heard you talking about is that very important missing middle, which is the affordable housing piece.
Yeah, so so the areas that we focus on, we'll look at low income at about, or deeply subsidized at about 30% of the average median income. When we're talking affordable, we're looking at around 60% of the average median income. When we're looking at workforce, we're looking at around 80%. And then you've got your market rate.
And I think that's a very important distinction, because the kinds of services and the types of housing and also the supports that are necessary for those projects really changes significantly when you go from the low income to the affordable, just that jump alone. But by providing more of the affordable housing, this is helping with the housing stock within our shared urban growth boundary that we are very much behind.
Yeah. Oh, we need more of all of it, no question. Right now our Section 8 waiting list is close to about 5,000 people. We've got 2,800 to 3,000 or so vouchers out in the community right now. As prices have gone up, we've had to get creative in how we work with HUD on how much subsidy those can provide. And so rather than looking at Salem as a whole, we've gone to basically neighborhoods and zip codes and the subcodes to get pricing in smaller areas so that we can get our subsidy up higher. Yeah, so there's just not enough out there.
And one of the terms that has been talked about tonight is rent burdened, and in the case of Keizer, severely rent burdened. Do you want to talk about that just a little bit? Because that's an important term to understand. Sure.
Just, the rent burden is just how much of your income is going towards your base rent, so when we're looking at individuals that are at 30% of the average median income, they need a full subsidy of their rent. They're fully rent burdened. So, yeah. So the higher the income, for the same unit, the less rent burden they are.
And then the percentage of the population within a community that are in that rent burdened or severely rent burdened category then triggers additional scrutiny, work that has to be done by the communities to figure out what levers can we push, what opportunities do we have, what can we do to relieve that, because being severely rent burdened is not a badge of honor. It's we got a problem.
Yeah. Oh, it's been, over the last few years, I think we've all have heard stories about people that are getting rent increase after rent increase after rent increase, to the point that then they're priced out of where they're living.
Well, and then housing stock turns over like that. We have like very little vacancy, And this is in all income levels as well.
Well, the micro units that I was talking about downtown, they're not open yet. They're still months away from being open, but they're doing a really good job at pre-leasing. So
Yeah. That's a neat concept.
Yeah, I think now we will go to, originally I was going to have everyone put their questions in the chat, but I think we'll go to just raising your hand if you have a question. So does anyone have any questions? Oh, no.
Some you can't see, can you?
Looks like Carolyn.
Yeah, I just have a comment. I appreciate all of this. Once about 20 years ago, through no fault of my own, I came this close to being on the streets with my son and my 5 cats. As you can see, they're still with me. And I had a coworker, and I had a travel trailer, and she allowed me to park it in her driveway for 5 months so I could recover from the financial loss that had put me there. And I would have had to move back to Texas into my mother's home if I had not been able to had a friend that would do that for me. So it's dear to my heart. I've corrected many people when I hear comments about, well, those people, blah, blah, blah. And I just bite my tongue and I ask them questions. And I've been able to pretty much get to anybody to understand that this is not, we might look at it in a certain way, but that's not fair. And we have no idea. And we've actually gone out amongst these people and found out why they're there. So I appreciate the opportunity to be able to participate and to listen to all of you tonight. And I appreciate everybody who wants to help, because it's not a simple thing. And without, I had a friend years ago who said, you know, we all need to eat and be able to eat and live indoors. And that's really basically what we need to help these folks with, so they can find some hope. So thank you,
Caroline.
Thank you.
Somebody. I guess I have a question about the tiny homes and land use or zoning, and how that can work together. And I guess it's for Kristen. How?
So I will start by saying that land use is not a part of my department. So I will pretend to be an expert here. I'm not the expert with the city. That falls under our community development department. You know, and honestly, at this point, Elizabeth might know more about the zoning for tiny homes than I do, because of the work that she's been doing. You know, but but as a barrier, there is the land use area, but there's also the cost and infrastructure part of it as well that's a barrier. And sort of making it all financially pencil. But if you want to jump in here and just talk about what you've encountered in trying to cite this, you probably have a better firsthand experience with obstacles that you've run into than I do.
Yeah. Well, right now, obviously, is the available land that's appropriate for the population we're talking about. If they have an open space in downtown Salem, not necessarily the best place to put a bunch of tiny homes or micro homes for that matter. So, and yes, Kristen is right. the zoning and all of the infrastructure. In order for you to put the homes on there, they need access to all of that plumbing and electrical and all of that. So the penciling is a large part of that issue, but we are very close to looking at a specific lot in the kind of northeast section of Salem, and we're almost ready to sign on the dotted line. There are some things that some boxes that need to be checked for that. So look for a press release very soon for us. We're hoping, as I said, to do something this summer. Lynn, do you have your hand up for me or just in general?
Lynn
Thank you.
Jarvis.
I had a question, and this was for Kristen. Did you talk about single tax lot urban renewal projects? Did I hear you say that?
Yes.
So tell me, what is that? I've always thought that they had to be large projects.
That's traditional, but it's not required. There's no statutory requirement that says that you have to have a whole lot of acres, or that, a huge boundary. Back when I was in Wilsonville, we created this concept for industrial properties coming out of the recession. We had about 2 million square feet of unused former warehouse space where GI Joe's and Nike, all these businesses used to be. So I created a program there to create single property urban renewal districts for each of these buildings, so we could provide a direct property tax rebate. So they'd pay their taxes, it would flow to the urban renewal agency, and we would rebate it back to the business as an incentive to reuse that space and convert it to a higher use, a manufacturing use. So started that in Wilsonville, and then coming here, looking at some of the challenges for getting affordable development throughout the community, and having conversations with Mountain West and working with them on the Cornerstone development, and conversations about what they were doing out at the North Campus. We thought, this might be a way that here we've got a developer that's going to do a market rate development here. How can we get affordable units in that development? And so we started those conversations about would it work, would it pencil if we were to create a single property urban renewal area for that apartment development and do the same sort of mechanism. You pay the taxes, and then we rebate taxes back to you in exchange for getting affordable units within that development. And then over time, if they were to say sell it and the new buyers only wanted to have market rate, then the rebate would go away. So the rebate's only in place as long as we're getting affordable units there. Mm-hmm. Yeah, and it would be replicable in other parts of the city.
Thank you.
Mm-hmm.
There we go, being creative again.
Yeah. There was a question on the chat of what the barriers are for tiny homes, and they mentioned also that California was getting rid of the tiny homes. And then my question is, would the people be paying rent for the tiny homes, or would they be housed there rent-free?
I would say that probably depends on who's operating it and the development, whether or not they can get other sorts of like vouchers or other support to pay those costs. I know United Way at one point was looking at trying to do developments like this that would just be like $200 to $300 a month.
Correct. And that was specifically for senior populations.
And talking about barriers, one of the barriers is NIMBYism. Businesses and residents that don't want them there.
Mm-hmm.
And that's a big hurdle when it comes to changing land use, you know, and getting a zoning waiver to be able to
Right.
put in that area.
Sean Nickus. Unmute.
Thank you. I forget I have double mute here. Hey, I was wondering if it's possible to put tiny homes in people's backyards, homeowners' backyards, and if that could actually be used as a plan to stabilize at-risk homeowners with rent that would actually come from the city or what have you. Is that something that's possible to do? I mean, I know.
Yeah, it is. It would fall under accessory dwelling unit. So that part of our code.
We and Keizer also, this is under state law now under House Bill 2001, I think, but we had already, and Salem had already moved forward with what we call ADUs or accessory dwelling units, also known as granny flats or, those smaller homes that are on your property. And they can be internal and external. So if you have a home where you have a level that has
Oops.
Do we
Oops,
lose
something
you fall off?
happened.
Yeah.
Just
Pick up on where she said, yes, you could build them within a garage, within a basement, you know, attached or part of your home or separate. There are usually some square footage requirements, you know, that they can't be over a certain size. I think one of the challenges is that they can be kind of cost prohibitive. A lot of them, you know, it's going to cost you $70,000 or so to do a freestanding one on your property. It's really, unless you're, you know, very handy and can do a lot of work yourself. But if you're going to hire somebody to come in and do it, that's about what it's going to cost you.
would it be different in cost from placing them inside of a tiny homes village or something like that for homeless people to live in?
It depends on sort of what sort of scale you can get. Sometimes you can reduce some of those costs just by the scale of building more of them. There are a lot of it's just going to depend on different site factors. You know, on a lot of homes, you're going to have to bring in a crane and lift things over into a backyard, which can be really expensive. It depends on how you go about it, whether you're building it from the ground up or buying something that's a prefab that you're lifting over, how far you have to run sewer lines and water lines. And sometimes if you're doing it, you know, if you're going to do 6 of them on a property, you can get some economies of scale.
So for example, in the property that's behind my house, there was one home with a big backyard, a big front yard. Now it's a house ADU. And it's lovely.
You know, thinking about like where I am in my life and like, you know, picturing ahead towards retirement, I'm really surprised that there aren't more homeowners that aren't doing this with the goal of, okay, I'm going to live in my bigger home now and rent out the ADU. And in 5 years, 10 years, I'm going to flip that dynamic and I'm going to live in the ADU and retire and travel and whatever and rent out my house and have, you know, I would think that there'd be a lot of folks that would be doing that.
Well, to answer the question about where am I going to go if I downsize?
Yeah, exactly. Right?
Out the back door.
Where's all this stuff going to go? So
Yes.
Sally Holloman.
What about travel trailers? Can they be used as tiny homes?
They cannot be used as tiny homes. That gets into building code kinds of issues and other zoning issues because they're not plumbed in. They're not wired in. So in most neighborhoods, they're not allowed as homes.
So if they were plumbed and wired, would that be more expensive than building a tiny home?
Mm-hmm. I think we still run into issues with building code and zoning.
But to that point, under the emergency order right now, we do allow people to have people live in them if they're on their property. Just if they're parked on the street, they can't have their wings out because they'll beam people going by. Um, that's a really bad idea. But if, as long as it's completely contained on the property, under our emergency order, we do allow it. And then Kristen, you've got, in the partnership with Marion County over at the pavilion, the safe parking for people to
Yes.
camp there.
Yes. Yeah, and we've had the camping out at Cascade Gateways as well in vehicles. And we have other areas where we allow it as well.
And I think Silverton also has a facility for that, for trailers and campers. Especially with the people living in them right now as they're trying to figure out where they're going to live or getting ready to rebuild in the canyon. One of the things I want to say for City of Salem is that over the course of the Homeless Alliance development and building the relationships, I think it's really helped Salem understand that the burdens of taking care of so many people with so many complex needs are not Salem's problem. There was that attitude, and we had to really fight back on that. I had people tell me, that's not our problem, it's Salem's problem. And we're going, no, it's a problem that humans have, and we're going to work together. And it was very important to build those relationships. And the ones not here tonight, also very, very key partners is Marion County. Been very important in this work as well. But we're in it together, right, Kristen?
Absolutely.
And Liz and Stephanie and Lynette, we're in this together.
Yes, we didn't hear from Lynette, where I can't see where she is.
Linnell Wilcox.
Oh, Linnell.
Linnell,
Sorry.
yes.
My
Hi.
bad.
Can you
unmute, Linnell?
unmute and tell us about Safe Sleep?
Sure. Thank you. So I have the honor of being the manager of Safe Sleep. We've been open a year as of December 15th, so a year and a couple of months almost. We served 185 non-duplicated people last year and a month. And women came from all walks of life. We had anywhere from 18-year-old women who'd run away from home to professionals who had lost everything from cancer or death in the family, to professionals that had just experienced a stroke and couldn't go back to work because they could never recover medically to be able to earn the level of wages that they had, and then spent all their savings just trying to get by. It really makes it so obvious that this could happen to anyone. We started from a warming center model just because I had been volunteering at a warming center for years before Safe Sleep opened. And in a warming center model, we welcome people in. We want to treat people with dignity and respect and serve individuals instead of saying the coffee's over there. It's going to the coffee and, how can I help you? We would like coffee. Do you like cream and sugar? And really serving people dignity and respect because they're usually treated like they're invisible or they're vermin. So we started with that model, first come, first served, and then COVID happened. And then we could no longer have volunteers. So the level of service that we could offer just drastically changed overnight. And we were also told shelter in place. And what does that mean for a first come, first served nighttime shelter? So we talked to Jimmy Jones and he's like, I would suggest just staying with whoever you have right now. That's who you have. So it was no longer first come, first served. It was no longer where you take your property with you every day. It's like, since we're going to have the same ladies every night, you can store your property here. But we no longer had the ability to serve everyone coffee and serve everyone dinner and make beds for people. It was like, so now we, if we're in this together, if we're going to be able to stay open, it's going to take everybody stepping up and, can you help us make the coffee? Not just tell you where to go, but can you help us make it? Can you help us clean? Can you make your own beds? And it was amazing to see how women responded to that. Most of them were like, this actually makes us feel more relevant. This makes us feel more worthy, more community. So now, even if COVID wasn't happening, we would stick with this current model. Women have told us it has saved their lives. Some women have said that just having the breathing room to be able to know they can sleep safely and not be looking over their shoulder has made such a huge difference in their lives. We've had women get jobs and get places. And we've also had to realize, some of the perceptions that I had of, if you give breathing space and some stability to people, they'll be able to move forward. And some of the things that I've learned along the way is that there's way more abuse and trauma than I ever really thought there was. And that makes way more of an impact in people than I ever realized. Stephen Goins from Northwest Human Services has a talk about the homeless brain. And I was able to hear that at a time when I had already been at the shelter for about a half a year. And I think if I had heard it in the beginning, it would have been like, yeah, that probably is true. But having the opportunity to hear that talk after the shelter had been operating for 6 months, it became so, it just crystallized so many things where, I thought almost everybody could get a job. Everybody has marketable job skills. But if you've been so traumatized and experienced so much abuse through so much of your life, what does that do to how you're able to interact with people? What does that do to your emotional adeptness and being able to understand that some people will have marketable job skills, but don't yet have the emotional life skills? And that's going to take longer than I realized. And that's really hard to see because you can see people with so much potential and so much ability to just do a job and do it so well and do it so energetically and happily and feeling like they're making a huge difference. But if somebody looks at them wrong, they're crushed. And, how does that work in a job environment? So there's way more work that needs to be done. And there's way more people who are experiencing this than I ever realized. I thought abuse and trauma is like, it's the exception, not the rule. And I still hope it is the exception and not the rule, but it's way more common than I ever realized. And seeing so many women in those situations is heartbreaking. But then seeing so many women feeling like this makes a big difference and that they maybe could get out of this or they can feel hope for the first time ever is heartbursting. So it's a mixed blessing. But I'm honored to do the work and being able to track the numbers is also, it's more boring, but it's really relevant because when you can see how many people are coming to us and finding us out of nowhere and being able to stay with us and see what a difference it might make in their lives, it's rewarding and it's humbling at the same time. So I'm very grateful to United Way and everybody who makes it possible. And just like everybody's been saying, it's such a collaboration with Arches and Northwest Human Services and all of the different partners that come together, and the continuum of care, being able to share different things and resources that we're going to be able to take advantage of as far as like being more adept at HMIS in the future. So it really takes a village, and the village is happening.
Does she have room now?
Well, thank you. A question came up whether you have room, if you have any space in Safe Sleep now.
So right now we are temporarily closed because of COVID. We had one woman test positive. We're reopening on the 14th. And at the time that we closed, I think we had 3 open beds. And we have a mom right now with 2 children who is on our wait list. So she'll be taking those beds. So currently, I don't think we'll have any openings, but it does change. Somebody moves in with a boyfriend or somebody does get housing. So we do encourage people to check with us whenever they have, a need. And if we don't have an opening, then we'll kind of keep you in mind and you can keep checking in. And people do come and go.
Mm-hmm.
And you're also looking at expansion, right?
Yes. Liz could probably speak more about that, but They've United Way's key people, Rhonda and Liz, I think, have been very involved with working with an architect to plan a remodel where we will ultimately be able to shelter 40 ladies instead of just 19. So we're very excited about that upcoming change. It'll be a few months away, I'm guessing, but.
Well, we had our final walkthrough today so that the engineer and the contractor, so the AC and Co were the architects for that, and they helped us with some amazing use of space. They're doing a really exciting storage room that's heated so that any of the belongings that the unsheltered would have can go in this area. It's one of the biggest things. If you think about that and you're carrying everything you worldly care about with you all the time, it's really hard to feel like you can have a place to begin. So that's going to be one of the things that we're pretty excited about.
Wow.
Yeah. Nice.
One of the projects that hasn't been talked about a lot that is going to make a significant difference is the new Union Gospel Mission, which will house 300 men and will be open 24/7 with bathrooms. It'll be monitored, it'll be staffed. It has been designed with trauma-informed care in mind. It's like safe sleep. It's being thoughtfully done so it can be a place of healing and of rest and growth. And it takes intentionality to get there. So I'm really excited about UGM opening in June.
Yeah, that is a good thing.
You know, since we are speaking with the League of Women Voters here, I'm going to put in a pitch. Funding for capital to build things like the mission, to build a lot of these different projects is not the biggest challenge.
I'm watching a thing on TV.
Oh.
I know on computer.
There we go.
Excuse me, Sharon. Sharon, can you mute Joan?
I just muted her.
Okay, thank you.
But funding for operations, you know, the ongoing needs, especially when it's case management kinds of needs and the facilities maintenance, those funds are so much harder to come by. It's getting investors, you know, getting the construction money. Yeah, I mean, that's hard, but it's doable. But it's, you know, when we start talking about navigation centers and duration shelters and those sorts of things, it's the ongoing maintenance and operational costs where we really struggle and where we need different funding mechanisms to support those over the long term.
Oh, yeah.
I see most grants don't actually cover operational costs in their allocations.
Linnell put her hand back up.
I was just wondering, I haven't had a chance to talk with anyone at Union Gospel Mission, but does anyone know if the capacity is 300 even with COVID, and if their low barrier might be become a little bit lower since religion is a big piece of their program, and sometimes that's a barrier for people?
So what I do know, and Dan Clem can speak to this far more better than I can, the life program for the men who live there and enter the life program, religion will be part of it. But for people coming in and using the day facilities, that's not a requirement. It's an opportunity, but it's not a requirement. Does that help?
Is 300 even with COVID? Do you know capacity?
That I don't know.
I don't know. I know they have with the residential program, I think that they don't have to make a change there. I think they're okay. But I don't know about their, you know, the overnight stays, what their capacity is. That's a good damn question.
Thank you.
Okay. Well, I think if there are no more questions or comments, we will wrap up for tonight. And I thank you very much, Mayor Cathy Clark and Stephanie Bobb, and Catherine Schrader, and Kristen Rutherford, and Elizabeth Schrader, I'm sorry, not Catherine, and Linnell Wilcox. Thank you all for, and Jan Calvin. Thank you all very much for speaking with us. It was quite a lot of information to take in, and I think it'll be a good program to repeat. So thank you very much.
Thanks for
And
having
Welcome.
me.
Thank
good
you for
night.
having me.
Yeah, good night.
This
Good
was-
night.
Good, everyone.
Good to see you all. Good night.
Good night.
Good to see you.
Good night.